be specific. So, Mr. Eson, good morning, sir. Sorry, good afternoon, sir.
Good afternoon.
I'm happy to have you here today.
Good afternoon, everyone. Good afternoon, the listener. It's a good time to be here. Tim said FM 91.5. Oh, sorry, 94.1 FM.
Yes, so today we want to discuss, we're in a period of COVID-19.
Yeah.
So, and we want to choose a particular topic, which is depression, because we know it is during this time that the prevalence of depression will be more common among our people. So, sir, to start with, what is depression?
Depression. I'll start by saying that every part of the body can be diseased at any point in time. Be it the head, the nose, the ear, the mouth, the hands, the stomach, the legs. Any part of the body can be diseased. And in particular, when we are talking about depression, we are talking about a disease that occurs inside the brain. And in the brain, we have different kind of disease that can occur to the brain. We have some that can affect the thoughts of the individual. We have some that can affect the behavior of the individual. We have some that can affect the personality of the individual. But in this case, when we are talking about depression, we are talking about the one that can affect the mood of the individual. The brain is the one that controls the whole activities of the body, the activities of the organs in the body, the activities of the individual, interaction, and relationship with people. But in this case, the mood of the individual is affected, and it affects the way that person relates with others. So, in short, we say depression is a mood disorder that causes persistent sadness, feeling of sadness. The person is perpetually having sadness. The person is having loss of interest in the activities of daily living or the activities that give that individual pleasure and other things that make that person functional that are affected. Before you know it, you start seeing a lot of things in this individual, in which we discuss as we go along.
Wow.
Okay, thank you, sir. Sir, I would like to ask a question, sir. What are
Right.
the identifiable causes of depression?
When we're talking about causes, we have a lot of causes of depression. We will pick on some. One, the one that firstly happened, or we can identify as the basis, is what we call biochemical problem in the body. What I mean by that is that we have chemicals that controls individuals' functionality rather in the brain. For somebody to be happy, you have to get enough of some hormones in the body, or what we call neurochemicals, also known as neurotransmitters. One of these neurotransmitters is dopamine. Another one is serotonin. These two, we call them excitatory neurotransmitters. They make individual to be happy often. And when these neurotransmitters are not enough in the body, there's a particular amount an individual needs per day to be happy. But when the neurotransmitters are not enough, that individual is bound to experience what we call sadness, because the neurotransmitters are not enough. Another thing that happens is what we call genetic problem. Depression happens to parents, either the father or the mother, and it won't be a surprise for you to see the children experiencing depression. Sometimes it happens between maybe twin. If you see it in Taiwo, it's possible you see it on Kinde too. So that's another thing that happens. So in other words, we can say it is hereditary, an individual that the parents experience depression, the children also can experience depression. And another thing that happens is personality. Personality. We have some, when we are talking about personality, sometimes we put it in forms of phlegmatic, sanguine, melancholy, and choleric. There are some that you will see on them through their personality that these people are not always happy. Melancholy, for instance, you see them even when they are happy, you will see the radiance so much on them. And also we can also attribute that also to another one we call phlegmatic too. So personality can affect individual and later can lead to what we call depression. Another one is what we call environmental factor, especially the one that I will have to relate with the current pandemic in town or in the globe presently. What are these things? Especially this period, you see a lot of violence. You see a lot of people beating themselves because they are angry. They are not happy with situation of things, and any little thing can actually trigger anger in them, and they can start beating people up, or when they are affected in one way or they were dealt with, before you know it, you see these people not happy because of that. Then physical and sexual abuse. For those that experience physical and sexual abuse, depression is not far from them. You see them, they will start becoming moody. They don't want to talk to anybody. They don't want to relate with people. And so on and so forth happens to them. And apart from this, we can also say that we still have what we call poverty, especially at this period when businesses are going down. Those that have personal businesses especially are way affected at this period of time. Many people could not continue their businesses, and those that could feed themselves 3 times daily, sometimes some of them cannot feed themselves once now. So it's not far from them to have what we call depression in these people. For those that could not afford good health, poor health can also cause depression. Maybe somebody is sick, he does not have enough money to take care of him or herself, or even if he have the money, as much as he spend money, he's not seeing results, he's not improving in his or her health. Depression is not far away from this set of people. So these are the areas. Then we can also say that stigmatization for those that have COVID-19 at this period, despite the fact that some of them are out of this disease condition, they are healthy, they are out of COVID-19 symptoms, still you will see people that will not want to relate with them. You see people that will not want to talk to them, and before you know it, if these people are very close, maybe in personality or in their genetics, so depression is not far away from them, that they will experience depression through this means.
Okay, wow. I've learned a lot from you. Thank you, sir.
Welcome.
Yes, we all know the word depression, but most of us just use the word. We don't even know when we are depressed. That's the problem with us, especially Nigerians. How do I tell that I am depressed? Like, what are the signs and symptoms of depression, sir?
For depression, before I will go to symptoms, I want to want us to note this. One, depression can affect anybody. Anyone can be affected, be it king, be it medical practitioner, be it a lawyer. Anybody can have depression at any point in time. In fact, it was studied some time ago that more women are prone to depression than men. And it was even studied also that sometimes we have about one third of everybody in the world having depression, not ordinary depression, severe depression at one time or the other. So depression is not what we can just say It's meant for some people. It's not meant for some people. Anybody at any particular time can be subjected to depression. And when we are talking about depression, we have some particular things that are peculiar to these people that we are going to note before we can say this person is having depression. First thing is that you have these people having persistent sadness. I mentioned that when we were defining depression. Persistent sadness. They are always sad. You never see them being happy. Either good things happen to them or bad things. They are always having persistent sadness. Feeling of hopelessness. They believe that it cannot be well again. Things cannot be better again. Things cannot improve again. We have some people that are having feelings of guilt. Maybe they did something long time ago, maybe about 20 years ago. They beat somebody up, and at the end of the day, maybe that person lost one or two things, maybe the hands or the finger. And this person, anytime you remember that story, is always guilty. We also can have these people having restlessness. They are always restless. They move from one room to the other. They pace up and down. They don't know what they want to do at a particular time. They get to one room, they say, I've forgotten what I wanted to pick from the other room. Sometimes we can also have what we call irritability. These people are always irritable. They don't want people around them. Any little thing can trigger them off. Anger can also occur. Then we have what we call fatigue and decreased energy. You know, they're always losing energy. I'm tired. They yawn every now and then. You know, you just don't feel them being agile at any time. They always feel like they are weak. They are not having any strength in them. Then we have what we call a thought of suicide. That's in severe cases. Although we still have, if we have time, we'll still discuss that. In severe cases, you have what we call thought of suicide. They want to kill themselves. They feel like the world is nothing again. They don't have anything to do in this world again. The best thing is to take their own life. And sometimes you have what we call insomnia. They don't sleep well. Maybe between 8 p.m. and 8 a.m. they sleep for 2-3 hours. It's not good enough. For individual to have a sound sleep, that person must have at least 6 to 8 hours of sleep per day. So when somebody is now having 3 hours, 4 hours of sleep, it's not good enough. And sometimes too, the opposite can happen to some of these people. They can oversleep. They can sleep more than necessary. Maybe under 24 hours, they sleep for 12 hours or they sleep for 16 hours. You will know that these people, they are not good enough. Sometimes too, they don't want to eat. They don't want to eat. Sometimes also they can eat more than necessary. So any of the two also can happen to them. And we also have what we call difficulty in concentration. When they are in class or they are at work or they are at where they do businesses, they cannot concentrate for once. So this happen. We also have what we call loss of libido. A lot of signs happens to these people. So I want us to know that when we are having some of these things and they are persistent for more than 2 weeks, I repeat, for more than 2 weeks, possibly this person is likely to be having depression.
Wow, that was very interesting, sir. So I have a very important question. Can kids be depressed?
Yes, kids can be depressed. It's just that what can depress kids and not what can depress the elderly. For children, if the parents are not too keen about the feelings of the children can feel depressed. Or maybe the children, they understand their parents. When they discover that this parent can afford this, maybe like school fees, but the parent could not pay the school fees, the children will start thinking, why is my father doing like this? Why is my mother behaving like this? After all, they have this money, but they don't just want to pay my school fees. Or sometimes too, in children, we can have depression when there is what we call bullying in schools. You see some of these children, they bully their other students, the pupils too. They can call them, see your head, big head. They can tell them, your father has gone, your father has run away from the mother. Anything that they know that can actually bring about pain to others, they do it. So when you know your children are doing this or they are keeping to self, they don't want to talk to anybody, please try as much as possible to ask them what has happened to them and get to know deep down what is their issues. And sometimes you can see them crying always. I remember of recent one of my colleagues saying that my children, that's where the father that is about 7 years of age, always crying. I informed her, I said, please go and ask this child to know what is the problem. It can be that this child is having some things that he cannot express. He doesn't want to tell the father or the mother. And the best way to react to it is when there is any issue, he starts crying. So children can have that. But for adults, those things we have mentioned so far, they are the things that we see on adults. And that will give us a pointer that this person is likely going to have what we call depression.
Sir, you also talked about insomnia as one of the signs and symptoms of depression.
Yeah.
So does that mean if I'm not sleeping well, I'm depressed?
No. As I said earlier, you must have, for what we have 3 categories of depression. We have mild, we have moderate, and we have severe depression. For those that have mild depression, you must be able to pinpoint 4 of what I've listed above: persistent sadness, feeling of hopelessness, feeling of guilt, irritability, restlessness, loss of interest in pleasurable activities, difficulty in concentration, fatigue and decreased energy, insomnia. All these things, out of all what I've mentioned, you must be able to identify 4 that is persistent for at least 2 weeks on any individual before you can say this person is having depression. And it's a point of note here that World Health Organization will put depression under mood and behavioral disorder, because they discover that when the behavior of the individual is changing or the mood of the individual is changing, it's possible that a disorder, a problem, a disease is coming up. So when you have about 4 of these in an individual for 2 weeks consistently, it shows that that person is showing the mind symptoms of depression. When you have 6 of these symptoms I've mentioned above, it shows that that person is having moderate depression. And when you have 8 and above, it shows the person is having severe depression. And most of the time, they come down with what we call suicidal ideations and psychotic symptoms. Psychotic symptoms, they come in different ways. Sometimes it comes in forms of hallucination, it comes of delusion, it also comes in forms of negativity. It could be either of the two. We have what we call positive symptoms and we have negative symptoms. So for the positive symptoms, you start seeing the person having hallucination, having delusion. So these are what you will see in the individual. You say possibly this person is having severe depression, and you will see most of them, they come down with what we call suicidal ideation. They have the feelings that they are not worthy to live again, so they want to take their own lives. So those are the things you will see, and you will know that this person is already experienced what we call severe depression. So it could be in any of 3 categories we have mentioned about. But for somebody not to be sleeping alone and you want to tag that person having depression, it's not so. So we don't do that, because what that we sanction you, and even your body that licensed you to practice can revoke that license for you not knowing that at least 4 of this and above must occur in that individual over 2 weeks before you can diagnose depression.
Okay. Wow. So my next question is, what is the relationship between COVID-19 and depression? How does COVID-19 arouse depression in people?
Thank you very much. As I said earlier, This period is a very challenging period in the whole world, not only in Nigeria. You discover that a lot of businesses have collapsed so far. Even the aviation, the agriculture, the technology, every part of the system we run daily are into problem. Even the health, where people are being taken care, those that have that COVID-19 are being taken care of now. Even health system is having issues. Most of our facilities are filled up, especially those places that we made specifically for these COVID-19 patients. You discover that these places are filled up. Those that have businesses, they cannot run their businesses as they were having it before. A lot of businesses have collapsed. A lot of people have sacked a lot of members of their workers. This affecting a lot of people. For instance, somebody that is feeding, having a man having 3 kids or 4 kids, the wife is depending on him, the parents are depending on this same man, and maybe friends and other siblings are also depending on this same man. But during this period, the person is sacked. I tell you, depression is not far away from this individual, especially if some of the areas, some of the things that can potentiate, that can trigger depression are already in them before time. Sacking them from job can bring about depression at this moment. Sometimes too, I mentioned, for somebody that is not going to work, you even see some people that, because they could not go to work at this period, they have increased in size. You know, sometimes it's a blessing in disguise, but some people it's not a blessing. For some people, they are not happy that they are getting more weight every day. Somebody that was 60, 65 before this pandemic started, by now is weighing 80. And this is somebody that likes to maintain shape. You know, before you know it, this kind of person that can go to depression. Or let's say this kind of person is somebody that the husband used to complain that I love you the way you are, having this 60 kg weight. Now he's now having what we call 75, 80. Some people will say Kogbona. You cannot even pass. You can't pass when that person wants to come out from the room. You know, before you know it, this person will start having depression. And some people at this period, they could not interact. Sometimes some people, the only means of interacting with others is when they go to work. Now they cannot go to work. They are sitting down at home. Some people, the way they make money, even apart from their daily meal, maybe they do government job, but they still have some other businesses they do. Now they cannot follow up on that business. Maybe he's thinking that by the end of this year, he's going to enter his own building, and the business was already booming. But when the pandemic came, the business stopped. The money is no more forthcoming. You know, it's going to be an issue to this individual. Or for somebody like that has been planning to travel out. March, the pandemic came and the restrictions started. All the international flights stopped. Now he can no more travel. Or he has businesses abroad. He can no more visit the businesses. He does not know how people are running the business at this period. You know, anything. All these things at present is affecting a lot of people. Some people are even going to the extent of thinking of killing themselves because they could not have it rosy, and they are thinking, how much can I do at this period, or when will I come back to gain all I've lost at this period of time? So, or let's say for some people that have perishable goods that they cannot dispatch, they cannot sell at this period of time, and maybe let's say all the businesses, all the goods got destroyed just because they could not distribute it, they cannot take it out, or some things that are supposed to last long, maybe till about May, but around June, we are still in July now, they could not take it out, people could not buy those things again. These things can cause depression to people, and a lot of people are sitting down at home and they are not happy about themselves, they are not happy about the whole pandemic. Even those people that have the disease, those that have the disease, I mentioned earlier, those that have the disease, they could not they could not have the feelings that people love them. Immediately you hear that somebody is having COVID-19, you see people running away from that individual, even if you are sure that this person is free from COVID-19, people still run away from them. It can make some people to be depressed. You just see some people that have baseline issues with genetics or with biochemicals. Like, let's take, for example, serotonin. And that person is having this issue, have COVID-19, is back at home. Nobody want to visit him. Nobody want to talk to him. Nobody want to visit his shop. Before you know it, depression is not far away from them. So that individual will not move from one to the other. We need to be careful.
Thank you very much, sir. To our listeners out there, you ask questions for our guests, you can reach the studio lines 070 37450890 or 090 37578911, 070 37450890 or 090 37578911. Thank you very much, sir. I want to ask a question from you, sir.
Yes, sir.
What are the identifiable treatments for depression? But before you answer that, sir, to our listener at home too, you can also reach us on WhatsApp 07065024793, 07065024793.
Thank you. For treatment of depressed patients, we have what we call pharmacological treatment, and we also have non-pharmacological treatments of depression. For pharmacological treatments, we have what we call antidepressants. And antidepressants comes in different forms. We have one we call SSRI. Okay.
Hello, who's on the line and where are you speaking from? Hello.
Okay. So we have what we call antidepressant, I've said earlier, and this antidepressant comes in different forms. We have one we call selective serotonin reuptake inhibitor. What does this do? Is to perpetually release enough serotonin into the synaptic cleft. What I mean by that is that inside the brain, we have what we call neurons. And in between one neuron and the other is a space called synaptic cleft. It's inside this synaptic cleft that serotonin, dopamine, and other neurotransmitters are released into to cause perpetual happiness in individual. But in this case, the number of serotonin for that individual to be happy are very low, as I've said earlier. So what this drug, antidepressant of this type, will do is to allow the release of more serotonin into the synaptic cleft and leave it there perpetually. So when it is there in the synaptic cleft perpetually, the person is tends to have a raised mood, excitement, and that person will be very happy. Another one is called monoamine oxidase inhibitor. What does this do? Is to inhibit the monoamines. The amines are also the neurotransmitters. It inhibits the reuptake. After the neurotransmitters have finished their work, the next thing that happens to them is to go back into the vesicle, that is their house. After they have finished their work, they go back to the house. But in this case, monoamine oxidase inhibitor will prevent it from going back home. It will leave it at the synaptic cleft, and that will also raise the individual's level of mood. Another one we have is what we call tricyclic antidepressant. This one, it works also to make sure that these neurotransmitters increase and help the individual to experience perpetual happiness. So that is for antidepressant. And we now have some other forms of treatment we call non-pharmacological treatments. Why are we saying they are non-pharmacological is that they are not drugs.
One of it is what we call psychotherapy, getting to know the problem of the individual, assuring them, and making them to feel that it is going to be much better tomorrow. As much as you are alive, you have better hope. Anybody that is still alive have a reason to thank God and believe that tomorrow is going to be better. Making that individual to feel that there is still hope. And another time, you can do what we call diversional therapy. You can give that person sort of encouragement. You can give that person sort of listening to good music that can raise their hope. You can also take that person out, maybe to a very good place where they can enjoy themselves and they can have a reason to divert from the source of problem. So that's what we call psychotherapy. There is another one we call electroconvulsive therapy. This is a means of introducing electric currents into the temporal lobe to bring about a change in the behavior of the individual. Most of the time, we use this when other forms of treatment are no more working. So that's when we use this on our depressed patients. And most of the time, they are severe depressed patients. Another one what we do also is to make job available for them. For instance, at this period of pandemic, if you have somebody that is living there around you and you have some job you can give to them to fetch them money, please encourage and give it to them. We encourage you today, please give them job. Or even if you don't have job, but you have enough resources that you can share with others, it's not bad idea to share with others at this period of time. Some people, I used to watch some news these days that some people cannot even afford a meal per day. So it shows that those social people will not be happy. So if you have food, you can give to these people. If you have money, you can give to these people. If you have clothes, you can give to these people, and it will change their mood. Then also is that power of positive thinking. You have to have a mind that is going to be better. You have to be positive. You have to develop the attitude that makes you think that tomorrow is going to be greater, is going to be better, and things will improve for you. Think about years back. You are not at where you are now. So it shows that if you put more effort and you trust God, and with people that can support you around, it's going to be better tomorrow. With
Hello?
this, you will have a good time.
Yeah, who's on the line?
Fellow from Malaysia.
Okay, what's the question for our guest?
My question is that how can we treat depression? What are the drugs that we can use to treat depression?
Yeah. Thank you. As we have rightly said earlier, maybe you just joined us. I said it earlier that basically we use antidepressants, but I will not advise you to use any of it without consulting a medical practitioner, especially a mental health practitioner. They have to know the best form of the drug that they can use on you and it will work. Because some people, if you use tricyclic on them, it's not going to work. But when you interview them, you will be able to know if it is serotonin reuptake inhibitor that will work, or tricyclic that will work, or monoamine inhibitors that will work. So you have to get to know that before you can say you want to take any of the antidepressants. Get to know, meet with people that will discuss with you, and they will be able to tell you the best form to take. So don't go to the pharmacy shop and start asking of any antidepressant, please.
I hope your question has been answered. If you are just joining, you're on to Team Said 94.1 FM. It's the program You and Your Health from Sparkling Light Press Group. And if you have questions for us, you can use the studio line 070-3745-0890 or 090-3757-891. And also you reach us on WhatsApp 070-6502-4793. So a question is coming now from someone.
Okay.
The person asked, how do we manage depression in this COVID period? I mean, that's been answered. And another question is, why is depression rampant in this COVID era?
Yes. As I've said earlier, depression is rampant at this period because those things that makes people to be agile. And note this, it is when you are active, when you are moving about, when you are excited, when you are working, that is when most of these neurotransmitters are released. For instance, somebody that did business, maybe yesterday you did your business, you gained 2,000 naira. Today you went to work and you're able to make 20,000 naira. That person is bound to be happy. Do you understand? So, but in this case, you are not going anywhere. You're not even making 500 naira. Talk less of making 2,000 or 10,000 or 20,000. So it's possible that that person will not be happy. So not going out, not doing your normal business, not going to work, not relating with people that makes you happy, not doing those things that give you pleasure can actually make people to be depressed. So it's not far-fetched that at this period of pandemic, we have people that are more depressed than before. It's because of the situation of things. Activities are reduced. Those things that make us excited, those things that excite us, that makes us to be active, are no more there. Somebody that is sick, he cannot even, sometimes some people are even afraid to go to the hospital and take care of themselves. You don't expect that individual to be much happy. So these are the things that actually makes people to be depressed more at this period than ever before. So for that individual, you have to just look for a means of making yourself happy, get engaged, do something that can bring activities in you and release the production of more serotonin, dopamine, and other excitatory neurotransmitters.
Our time is almost up on the program. We thank you very much for joining us today, sir.
Thank you very much.
Any advice for our listeners at home?
Yeah, as I've said earlier, I continue to say it. This period will pass. This period will pass. It cannot be like this for life. That is certain. I want you to have hope and you believe that tomorrow is going to be greater and better. I wish everyone the best of time in this pandemic period.
Thank you very much, sir. And this is You and Your Health from Sparkling Light Press Group on Team Said 94.1 FM. Once again, my name is Oladokun Joseph Sparks, and with me today is
Ibidun Farida at Leader Sparks.
Join us this same time, this station, next week on Team Said 94.1 FM, 12:15 p.m. to 1 p.m.
Really nice. I take you on Arabambi. You wanna live long, you wanna stay strong. You wanna live long and stay strong. Live long and stay strong. I don't want that to move. Bílẹ̀ afúnni ni wọ́n sọ, olóyún abẹ́rẹ́, láì ṣiṣẹ́ abẹ́, ewé ń jẹ́, ogun jẹ́. Má ṣe lògùn, without doctor's prescription.
That was You and Your Health with Sparkling Light Crew. So join them next week for another edition of the program.
Team Said 94.1 FM, Òkè Àgbójà, Ìjẹ̀bú-Jẹ̀ṣà, Adé-orí Ọ̀kín wá. Team Said 94.1 FM, ó ta gbangba